Good evening, Singapore, and to all our viewers across the globe. Greetings to you, our friends, partners, and supporters. Welcome to Bayanihan Talks webinar series. I am Minerva Lau, the current Honorary Treasurer of Philippine Bayanihan Society, Singapore, and the host for tonight. We hope you are all keeping safe and well. In Singapore, we have entered phase 2 heightened alert, which means further tightening of restrictions on movements and activities so as to contain the spread of the COVID-19 virus. Health is important, and tonight we will be talking about our precious bones. We are delighted and honored to have as a guest speaker Dr. Joseph Rylan G. Flores, an orthopedic surgeon and sport medicine specialist. He will talk about osteoarthritis, why it is an age-related disease, and what the causes, symptoms, and available treatment are. For many of you out there, this may not be relevant yet, but it is always good to know how to recognize it and how it can be treated. Before we proceed, please allow me to introduce our Bayanihan Society here and give you a glimpse of what we are and what we do.
On behalf of the board of the Philippine Bayanihan Society in Singapore, I welcome you to the Bayanihan Center. The Bayanihan Center has opened its doors to support the educational, social and cultural needs of Filipinos and others in Singapore. Thanks to the strong partnership between the government of the Philippines and Singapore and the initiative of our founding president, Ms. Jenny Chua, and vice president, Mr. Ning de Guzman. Since its establishment in 2001, more than 13,500 people have undergone skills training at the Bayanihan Center. But the Bayanihan Center is located at 43 Pasir Panjang Road. It provides classrooms, facilities and support for volunteers and community groups to conduct various short-term courses including basic and advanced computer training, nursing aid, hotel and restaurant management, dressmaking, caregiving, cooking, and baking and cosmetology. To foster the socio-cultural ties between Filipinos and Singaporeans, we also organize the Bayanihan Walk. It is an annual event to bring together people from all across sectors of Singapore in a fun walkathon to promote integration of Filipinos with the Singaporean community. Tara na mak, Bayanihan Center na.
I hope everyone now has a better understanding of what the Bayanihan Society is and what it does. The society is turning 20 this year, and we hope it can be of service to many of our kababayans here in Singapore. Please do not hesitate to approach us for any training or skill ideas or cultural activity suggestion. Just contact our Bayanihan Center officers, Cecil and Mindy. And now, I am very delighted to introduce our guest moderator for today, Ms. Lila Bailon Makapinlak. She has a bachelor's degree in chemical engineering, an entrepreneur being a partner of Koino Air Travel and Tours and Chance Resources. And she's the president of Noblelife International. This lady, who is a founding member of Business Network Group, likes running, walking, and other fitness activities. She also gets involved in community and charity movements like our recent Bayanihan Walk event. Most of all, she's a wonderful wife and a mother of 4 kids. Without further ado, may I call on Ms. Lila Bailon Makapinlak to introduce our guest speaker for tonight. She will also be our guest moderator during the Q&A session. Ms. Lila, the floor is yours.
Thank you for a warm introduction, Miss Minnie. Okay, good evening to Philippine Bayanihan Society in Singapore and to all our viewers and guests tonight. We are now live via FB and many of our kababayans and friends in other parts of the world are also watching now. The topic is very interesting and timely. It's aging issues. Aray ako dun So let's enjoy the night with our speaker and happy watching. So I would love to introduce this because he's a good friend of mine. So he is an orthopedic surgeon and a sport medicine specialist. He is also one of the medical consultant of the Los Santos Medical Center and a consultant also of Lengfang Orthopaedic Center in China. He is a team doctor in UAAP and National University. He is also my medical consultant in Noblelife International. A warm welcome in our virtual health talk hosting from Singapore with Philippine Bayanihan Society in Singapore, my friend, a doctor, a movie actor, ayun yun TV and radio personality, and an international resource speaker, the carpenter, Dr. Joseph Rylan Flores. The platform is yours, Doc.
Thank you very much, Lila. Thank you, and good evening to everybody. It's nice seeing you here, though virtually. It would have been better if we are all face to face. I know we all miss it. It's been more than a year since all hell of pandemic has broken loose, but at least we have the virtual platform to still see each other maski papano. I was kidding, chiding Ma'am Lila, because if this were non-pandemic, we would have been right there smack in Singapore at the Bayanihan Center and enjoying chili crab and laksa. So thank you very much for the invite, and thank you very much, Lila, for that introduction and for being our moderator for this evening. So we were actually asked to discuss a little about aging. Doesn't really have anything to do per se with the pandemic, but nonetheless, because most of us are in lockdowns. I mean, Ma'am Minnie just mentioned that Singapore is becoming a little strict nowadays because of a possible sudden surge. So the problem with those who have problems of getting old are really sometimes adding on, not just on the physical, but on the psychological component, considering that they are really prevented from going out and doing their regular activities as they would have enjoyed like long ago. But hopefully with a little help from us, a little understanding of the possibilities, and hopefully we could have a better everyday living, so that, you know, come past all of this pandemic. I'm sure it will pass. We just don't know when, but it will pass. When it does come past, we actually will be able to enjoy more our own lives face to face. So without further ado, I would like to share my screen. So let's talk about bones and joints. Ma'am Lila, can you see my slides already?
Yes, Doc.
Okay, great. So let's start off. 206 bones that make up the human skeleton. You know, it's like any inch of us, that's our framework, and that's what holds us upright. So that's 206. It has dual functions. It's there for structural support for the muscles and vital organs, but it also serves as a depot for other essential nutrients, calcium included. Now, I just want to clarify on things, because once somebody hears about osteo, they interchangeably use osteoporosis and osteoarthritis. So let me just to define, so that would put it aside. Osteoporosis is a bone mineral density that is reduced with bone microarchitecture actually deteriorating. It's one reason for us, once the elderly probably might have fractures, they're very, very prone to fractures. And the worst thing is, it is still a disease, a silent disease. And that is what osteoporosis is all about. In contrast, osteoarthritis is a condition involving the damage to the joints of the body, and it's one of the most common forms. It's degenerative in nature. But whatever the cause would be, it's actually irreversible. That's the reason why 70% or even more of the time, the generation plays a very big role. We still cannot stop. growing old. Nobody has yet invented a pill to actually let us stop growing old. So until that time comes, what we can do is work around it to slow down this degenerative process. So there is a difference between osteoarthritis and osteoporosis. So probably we'll talk about osteoporosis on a different schedule. And ano, Ma'am Minnie. So going back to arthritis, Time Magazine, December 2002, has actually declared a epidemic portions of arthritis. Why? Because the world is growing old. Generations are growing old. So they have already declared that as early as 2002. And in osteoarthritis, what is involved is actual joint, which means it's one end of one bone to the end of the other bone, creating that joint. And there are several joints in our bodies, just so as we mentioned, so we know there are immovable joints, there are slightly movable joints, and there are freely movable joints. You know, our skull is literally solid, but during the infancy stage, you'd actually notice that they would have still unended sutures of the skull, which means that hindi pa buo yung kanilang mga skulls. But if you notice in adults' bodies, the skull is literally solid, and the joints between one plate over the other is still a joint, except that it's not movable. On the other hand, we have slightly movable joints, an example of which would be our vertebral column. The joints attached from one level to the other, it still does move, but it moves very, very slightly. In contrast, the freely movable ones, our fingers, our wrists, our elbows, our shoulders, our knees, our hips, these are perfect examples of freely movable joints. And as I said, some examples of the freely movable joints would be your hinge and pivot, as well as your ball and socket. Your hinges would be your knees, in contrast to, say, the ball and sockets, which would be your hip and your shoulder. Now, let me just show you a picture of a cut bone. The one, if you notice, white area is actually your cartilage, in contrast to the yellowish bone or subchondral bone that you have underneath. Now, the cartilage is actually a protective covering. That's the reason why it is a vascular, it is a neural. What does A mean? A simply means without. So it doesn't have blood vessels, it doesn't have nerve endings. That's the reason why it's the best thing to protect the ends of bones. Why? Because our bone, in contrast, is very, very vascular. It's also very, very neural. That's the reason why if cartilage is gone, we would feel that much pain in our joints, more so having us difficulty with movement later on. Let me just show you a pattern, a schematic pattern of cartilage unit. We have collagen fibers. We do have all of these proteoglycan complexes, like similar to a comb, and crossed in one area of a unit. More so in comparison, it's probably your cartilage could be compared to how you build your house. Those concrete areas, you have metal bars before you pour in cement. So that's where you have your ground substance, and that's where your collagen fibers are. Now, as I mentioned a while ago, cartilage is actually avascular and aneural. So how does it actually nurture itself? So within that area, there is actually a sponge covering within the joint. It's in the intra-articular area of the joint. And this sponge is known as the synovium. And like any sponge, you try to squeeze it, fluid comes out. And when you try to release and relax it, fluid is sucked in. And then once it's pressed again, fluid goes out, and so on and so forth. So that is how actually nutrients reach the cartilage and everything else within the intracapsular area. So The more movement one does, fluids come in and out, nutrition comes in and out, and everything else is nurtured very, very well. But unfortunately, once problems start within the cartilage surface, the possibility of absorbing all of these things or all of the nutrients could actually be a problem. That's the reason why the permeability of that cartilage decreases, and the absorption of the fluid from the synovium would actually be quite difficult. That's the reason why it tends to become older faster. Now, let me just show you the action of our articulating surface. If you notice the first one, you actually have bone and the cartilage surface. It kind of bounces. When you have light load, it becomes in contact with each other. With heavy load, it's sometimes distorted a little bit, but if you notice, the bone actually maintains its shape. And afterwards, when the load is lifted, then you do have a rebound phenomenon going back into the normal or unaffected cartilage. That's how it actually would be simulated. You have your bone in the area, you have your synovial fluid within your capsule, of course, a cartilage covering these areas, and no pain, whatever happens, because you have a very healthy cartilage in that area protecting the edges of bone. On the other hand, that one would be quite painful. Once that cartilaginous end is actually gone, you're left with subchondral bone that is literally contacting with each other. And as I mentioned, bone is very, very vascular. It's very, very neural. You would actually have a lot of pain. That's why it's quite difficult to actually stand up from a seated position, or much more going up in a staircase. Oops, sorry. So osteoarthritis is the most common cause. And right now, although it's 1 million in the Philippines, that is already increasing. As of late, I think it's nearly tripled because the population of the Philippines has pretty much increased and escalated. And of course, the leading cause of disability, increasing the need for healthcare and giving the patient an impaired quality of life. It's defined as a non-inflammatory degenerative joint disease characterized by subchondral sclerosis, osteophyte formation, soft tissue changes. We'll actually show you some pictures about what they look like later on. So this is just a picture of what we've shown you in a video a while ago. Now, if most of you have already seen x-rays of or have undergone x-rays of a joint, I'm not going to be talking about all of our joints. I will be mostly talking about the knee, simply because it's the largest joint in our body and it's easily quite visible. But anything that happens in the knee can happen in any joint in our body, especially the freely movable ones, and that includes all the way to the tips of our fingers. Now, when you do see an x-ray, the x-ray is simply seeing calcific bodies, which means it can see bone as it is. Everything else would probably be just black areas or black spaces. And the moment that there are other changes, they would be able to see about it. But if we want to see the soft tissues, what we would probably need would be an MRI or magnetic resonance imaging. But for the purposes of osteoarthritis, most are actually already diagnosed simply with an x-ray. What you have in front of you is a typical x-ray of a person with osteoarthritis. And what do we actually see? First and foremost, that space against this space, it's actually quite different. You have a space there, but that isn't a true space. That's actually where your cartilage is present. And your cartilage doesn't have any calcific body. That's the reason why it's not seen on an x-ray. Hence, by an inverse proportion, you have a space here, you don't have a space here, then the possibility is the cartilage is already gone. Secondly, if you would notice the white edges here and here, they're relatively whiter than the other areas, and that's what we call sclerosis. What it does is, try to imagine, cartilage protects bone. So bone is quite confident that there's nothing going to be happening to it and it won't experience pain. But the moment cartilage decreases, bone now will anticipate pain. And when it does anticipate, it will grow. It will add on, increase in this area. That's the reason why it's whiter than in any other areas, because they are already expecting the possibility of, the loss of cartilage, exposing subchondral bone, being able to experience pain. That's the reason why it will grow. That's why it's whiter. Now, on the other hand, on the other hand, bone just grows. I usually compare bone growth to a 3-year-old holding a crayon, coloring a drawing or a portrait. And what would you notice? They just color. They won't pay much attention to the contour, the edges, the sides, the shadings. That won't matter. All they will do is, they like this color, they will color it. They'll color it purple, they'll color it red, they'll color it blue, green, whatever. And what would you notice? It will simply go across the actual border of the drawing. That's how bone grows. It won't just stay put at one particular area. It will go anywhere. It will go everywhere. And that is where your osteophytes become present. That is known as your bone spur. So if you have these three things seen on an x-ray, you have spaces that are already inadvertently decreased. You have thicker whitened portions known as sclerosis. Much more, you now have your bone spurs or osteophytes. These are evidences of arthritic changes, most of the time degenerative in nature. Why do I say most of the time? Simply because not all arthritic problems are caused by age. There are some that are caused by immune functions, immune problems like your rheumatoid arthritis. That's why you see it even as in young children, as young as 7, 8, 9, 10-year-old kids would have arthritis, because it's their immune functions that have problems. You would see it in people who have bacterial infections, septic infections. Of those who have had trauma to their joints, you would also see arthritis. Some would even have causes of arthritis with other medical conditions, probably like your psoriasis, your statin-induced arthritis. So there are a whole lot of things that can cause arthritis. It's probably a book this thick that we used to study. But 70 or more than 70% of the time, degeneration plays a role. That's the reason why that is what we are talking about this evening. Now, this is a picture of an x-ray. Let me show you next a picture, I hope it's okay with you, of a true cartilage. If you would notice, there's a procedure that's called arthroscopy. Arthroscopy, some would call it laser, but literally there's nothing laser about it. Simply put, it is just a scope that's inserted in the joint, hooked up to a camera in a fiber optic cable, all the way ending to a rather big monitor, so that we don't need to open the joint like a book. We can actually just seep through it. Pwede namin silipin kahit maliit lang, para mas mabilis din ang paggaling nila in the long run. Just to give you a picture, this is what we see. To give you the orientation, the head is over there, the foot is down there. So what you would see here is the distal portion of your thigh. That's your distal femoral area. You'd also see here the proximal end of your leg, or the proximal tibia. And that is what we call your meniscus. It's actually a soft tissue that helps in the tracking of the knee. Now, what would you notice? Excuse me. It's very, very white, pearly white, very, very smooth. Actually, it's very firm if it's touched. Hence, movement would be like gliding, no pain whatsoever. So that is what a normal cartilage looks like. What does a arthritic or degenerative arthritic knee would look like, there you have it. You'd have fraying of that smooth edge, hibla-hibla na siya. Not only that, you'd have areas of erosions. That is already bone that's showing, where in fact it's supposed to be covered. And if you notice the shapes already, so what happens is every single time that they move, it actually coarsely affects the other edge, of the bone. I would give an example for those who use gata in nyog. For those of you who cook, I mean, whether you're in Singapore or here in Manila, you tend to get out the coconut meat, diba, sa bao, either by hand or better yet, those small horses that you actually literally kinakayod yung nyog. You get the meat. That is what happens here. Every single movement, it erodes. Until such time, what would you notice? You'd actually hit yung bao, di ba? And then brown na yung kinukuha ninyo, hindi na coconut meat. That is already a sample of subcondylar bone being affected. So that is quite painful. And that's the reason why patients with knees like this won't probably be able to move much. And like I said, although we're discussing most of the time the knee, it doesn't happen just in the knee. It can happen anywhere, inclusive of your joints in the tips of your fingers. Like such. If you notice, the shapes are no longer firm and straight and relatively fine. Of course, these are just signs and symptoms. Last I mentioned, your loss of joint space, your grating or grinding joint, your outgrowths or bony spurs, or commonly known as osteophytes, your joint pains, the stiffness from that because of not much movement, and of course, the difficulty performing tasks, and sometimes the stability is affected, and of course, restricted and definitely painful movements. Risk factors, there's a lot, but you notice it's old age and obesity that actually plays a very big role. Old age, why? Because you've already moved your entire life. Subtract 1 year because you don't walk prior to your first year of life. But if you're a senior citizen at 60 years old, you've been walking, jumping, hopping, skipping, running for the past 59 years. So hence, it's a wear and tear thing. The older one gets, the older one possibility can experience osteoarthritis. On the other hand, it depends on how you use your body, because if your bodies are used too much, perfect example would be your athletes. That's the reason why athletes retire at a very young age, because their bodies would have used up what's supposed to be used up in an entire lifetime. Of course, obesity because of the weight that one has. Again, the wear and tear and pressure of things. That's the reason why I would see patients who are heavy would actually experience a little, not a little, but depending on how heavy they are, pain in their movement. Of course, all the other things like your gender, male and female, most of the time, well, nowadays, they're actually equal already, but it depends on the activities that you do as far as your occupation is concerned. That's the reason why, on the other hand, you also have your occupation. And of course, depending if you've had injuries or not, whether in the bone or the joint or other traumas that you might have. Some would say family history or genetics. A little bit. Why? With a family history, you'd often hear that, they'd say that my mom was like this, my dad was like this, my aunt, whoever is like this. But take note, most of them already are in the elderly age group. With genetics, I will agree, because there's certain genes like your IL-6, IL-10s, IL-8s, they're gene specific for inflammatory reactions. And sometimes they do play a role in how your body's formation of inflammation might be created. More than 33 million in the US are actually affected. This is an old one. It's actually doubled nowadays. I didn't change anymore the figures, but the prevalence of which is really high, and did see 9.6 and double of that of women 60 years old and above having symptomatic osteoarthritis. And if you notice in this graph, the disability burden, if you actually would include not just osteoarthritis, but the total musculoskeletal problems, you would actually near that of problems coming from ischemic heart diseases. So, what are the aims of treatment of osteoarthritis? Remember, if the problem is degenerative in nature, we literally can't do much about it. But what we can do is slow down the process of degeneration. So, our aim is to slacken the development of osteoarthritis. We try to prevent deformations and invalidity. We, of course, definitely less pain. We reduce the inflammatory reaction. We try to remove the risk factors involved, and we preserve, or much more important, improve the quality of everyday living. So we do have non-pharmacological interventions. Regular exercises, regardless of whatever happens, we still need movement. Bawal po ang batugan at ang tamad. We do need to move. Of course, diet and weight management, depending on what your activities would be. And physiotherapy is just a guided form of movement, whether or not it's just the actual exercise or with the help of some of the modality machines that physiotherapy has. Of course, the psychological support is still necessary. That has to be supported. Why? Because you have very, very active individuals that suddenly, just because of having pains, might not be that active anymore, might be very dependent when in fact they used to be very, very independent. So what happens? Most of them come into depression. So we don't want that to happen. That's why psychological support is necessary. Alternative treatments and therapies, yes. And like we were mentioning before we started the lecture, surgery if surgery is needed. Now, there are classification of medicine that we can actually give for osteoarthritis. These are the symptoms modifying drugs and, of course, the structure modifying drugs. Some of the management that we would give are actually for contradicting inflammation. And the most common ones that we could give would be paracetamol or acetaminophen, depending on where you are in the world. Your NSAIDs, or your non-steroidal anti-inflammatory drugs. Examples of your COX-2 inhibitors, or sometimes, if it's really too much, we do give narcotics. We do give mild narcotics, medium narcotics, and all the way to morphine if necessary. And of course, the mother of all anti-inflammatories, your steroids if necessary. Now, there are possible disease-modifying agents in osteoarthritis. Long ago, glucosamine and chondroitin are components of the cartilage matrix. Hence, they tried to develop this as an additional supplement. But glucosamine has been shown to slow the radiographic progression of osteoarthritis. But the bigger designs that were done, the studies that were done, one perfect example is your GATE trial way back in 2006 and 2008. As a matter of fact, extending it to the extended GATE trial showed that, they really didn't have much of a difference with those given celecoxibs and placebos for pain. That's the reason why I haven't given much of glucosamine for the past decade or so. What I do give, one of which is hyaluronic acid, which is also a component of the synovial fluid and cartilage. And this actually diminishes not just in osteoarthritis, but once one ages, the development of hyaluronic acid decreases. That's the reason why we do give it. It's a good nutritional component that can help your cartilage as long as it's present and to nurture that area. And actually, it's a viscous solution, so we sometimes mention it as it's like putting oil in your joints to loosen them up. Of course, intra-articular hyaluronic acid could help normalize because of the viscoelasticity of the synovial fluid. Although it's slightly invasive, why? Because we do inject it to the joint. I also failed to mention one of the things we do give probably would be collagen, because that is what also one of the things that the cartilage is built up with. Now, for management, we do give physical therapy, as I mentioned a while ago. And if necessary, sometimes we do some bracing. What we tend to do is, because of the disfigurement or the malalignment of that joint, we simply try to move a bit and try to correct that alignment as much as we could externally using a brace. Let me show you this picture. Your knees, based on your thigh and your leg, are supposed to be in a straight fashion grossly. But if you notice, this is the left knee, the right leg is on the opposite side. So what you notice is that the leg is actually in valgus, which means that it is moving outwards from that alignment. So difficulty in walking. This is an old lady of around 68 years old. I couldn't do anything much of her because I could do surgery because of a heart problem. I placed her on a brace. There you go. What would you notice? Slightly, we were able to align it somewhat. You know, in this alignment, a millimeter or two of displacement from the actual impingement in that area is very, very helpful. This lady actually enjoys walking nowadays, even with a Robocop-like brace that she actually has. Of course, the newer designs are much more streamlined than this bulky one, but nonetheless, it serves the same purpose. Now, like I said, it's not just the knee what we're talking about, but it can happen in any joint. Let me show you an example of the hip. As Ma'am Lila was saying, I'm just a carpenter and this is what I do, Carpentry 101. So, an artificial hip replacement wherein we try to replace the acetabular component, which is the socket in the pelvis, and change that ball joint of the head of your thigh. That's why it's a ball and socket joint. Let me show you an X-ray. And what would you see? Over here on the left side, you'd see, well, yeah, it's you still have enough space, rounded head of your femur, and that's your acetabular area. If you notice again, that white area, that's already a sclerotic edge. But if you notice, this is relatively still acceptable. As a matter of fact, the patient didn't feel anything on this left side. In contrast, the reason why I showed you that, so you could appreciate the difference on the right. And what would you notice? You don't have the space anymore. The shape of the head is no longer circle, it's actually ovoid. And you'd see that white area, that thickened sclerotic edge, because bone is actually developing on a much faster, higher rate, considering that it now actually experiences pain because of the arthritic changes. We, no choice. He could barely stand up. So we did surgery. And that's what surgery is all about. We actually replaced the acetabular area with a cup, and then that head, smaller though, because that's what the joint, the prosthetic joint is, and a shaft with already a stem inside that femoral area. Good thing is, that is a joint that one can actually move. So from a patient who actually wasn't able to be moving for the past nearly a year, weakened muscles and all, very much in pain, with the right amount of therapy, is able to stand up again and be able to move without much of a pain. Of course, there is pain because of surgery, but the difference between arthritic pain is surgical pain will definitely decrease, will definitely be gone in the next few weeks. In contrast to arthritic pain, wherein it actually increases, not just becoming persistent, but increases in intensity, making the motion or the mobility very, very much decreased. So Sometimes it could happen to both hips. And this is an example of someone in severe arthritis that we did for both left and right hip joints. Now, let me just show you my picture. No, as I said, that's a saw and I'm just a carpenter 101. So let me just show you a patient of mine with an admitted impression of osteoarthritis, severe knee left. Let me show you her preoperative x-rays. This lady is around 64 years old at that time. And what can you see? One, you don't have that space here anymore in contrast to the other side. Two, you have that very much whitened area of sclerosis. Three, you notice all of that up to there, that one, and on the other side, you see that, mga sungay, di ba? You see all of these? Those are your osteophytes or your bone spurs. That's the AP view. Let me show you the lateral view. And in the lateral view or the side view, you'd see that. You'd see this area already, sticking to one another. You'd see that spur. You see that very white area. And you'd see a huge osteophyte here. The joint doesn't move like a door that simply opens up. It actually glides. So when it glides, this area hits this area. So you could just imagine this osteophyte here at the posterior compartment hitting this area while you're seated. Try to stand up. This will hit this area. That will actually encroach and eventually ulcerate, exposing subchondral bone, giving you now problems of severe pain on standing up or going upstairs. Now, what we did was a total knee replacement arthroplasty. If it's okay, I will be showing some graphic pictures. So if you cannot stand it, unfortunately, I could blur out the area. So sorry. So this is a skin landmark we did. That's the knee to give you an orientation. Over there is the head. Down here is the foot. So that's a skin landmark because that's where we're going to do our incision. If it's okay. There we go. We've incised the area and we now show fat. That's actually subcutaneous fat. Afterwards, we are now exposing your kneecap or your patellar bone. And what did we find? We saw intraoperatively complete denudation of the left medial condyle, osteophytes in both femur and tibia, sloping and crater defect on left medial tibial plateau, which is very highly technical. So let me just show you what all of these things are. Remember, the normal knee is supposed to be very, very smooth, very, very white, glistening like a pearl, and giving us that gliding motion. And this is what we see intraoperatively. There you go. We actually see denuded areas here. It's no longer smooth. We have a whole lot of osteophytes in that area. We have ulcerations in this area of the kneecap. We've actually already deflected that area. This is actually your ACL, showing you also areas of degeneration here. So everywhere. So there's no longer cartilage in these areas anymore. That's the reason why it is so painful for this lady to be moving from a seated position and moving upstairs, most especially. So what do? We take out all of the soft tissues. We take out the meniscus over there. We take out the osteophytes over here, the bone spurs. Why? They're making the areas huge. That's why sometimes you'd notice that they might have huge joints. Some would say that they are actually swelling, but they're not. They're simply being pushed by osteophytes, making the joints larger. So we take out all of these. We take out that area as well, and these areas as well. We take out all of them. Afterwards, we drill a hole in the femoral area. Like I said, carpentry 101. So we now put in a guide wherein we actually would eventually cut the area. So that's your power saw cutting into the distal femoral area. and doing your front, your back, your chamfer cuts are what we call the sides or edges. And eventually, we now have that cut and prepared femoral side. If you notice, that is bone. What you see is actually bone. I mean, you go to the market, I'm sure you see these things with what your butcher shows you. Now, we do have a trial component, trying to see the size of which, if it fits perfectly. And this is an example of that. Then we continue in removing the entire tibial eminence. So we actually flatten it out. That's this area that we're actually cutting. That's your saw again. And eventually lifting the entire area. We're trying to determine how thick we would actually cut. And that's your tibial eminence taken out. That's your whole cartilaginous component. And what we see there is subchondral bone. Of course, we now put in the implants, we do a trial reduction, and that's how your knees are supposed to look. We also prepare your kneecap or your patella. We put in as well a polyethylene substance as a joint. That's actually your total knee components, though the tibial plate isn't there yet because we have yet to determine it once we actually place these components in the knee. So what do? We cement it in place. So we cement the tibial tray. We put in that tibial tray. These are made out of titanium, by the way. So anytime that we want the patient put into an MRI, it won't be a problem. Eventually, we also do the upper portion or the femoral area, put in that component. It's kind of like a mirror because that's made out of cobalt chromium, and it's relatively shiny once we clean it. And again, the polyethylene plastic for the kneecap. That's how your joint looks like. Now, if you notice, in any of the management I've actually mentioned, none in that area says that we cure degenerative osteoarthritis. All we do is simply decrease, if not remove, pain. And in this setting, because we've replaced the joint, what happens is there is no longer any attachment or any risk of having one edge of the bone literally become near the opposite edge of the other bone. So let me just show you an x-ray. What do we see? We see a space. Remember, it's not a space because why? We do have a plastic inset in between, which also cannot be seen by an x-ray. You have your bony area there. You have your bony area here covered with our titanium plates and cobalt chromium covered titanium plates. Don't mind that wire over there. That's just the blue Raytech lines of gauzes we put in front while we actually clean the areas to make sure we don't forget to take them out afterwards. Of course, on a lateral view, if you notice, again, there's your space, adequate in amount, including that area, and smoothened edges. So we now do expect the patients to actually be moving comfortably in the next couple of months or so. Just an example, I do have a patient just not on one knee, but for both, hence we do both knees as well. So I think that's my last slide. My point being is I've shown you how we can deal with it, but nobody has yet invented anything to stop us from getting old. So what do? We live relatively healthy lifestyles just so as we not stop, but we slow down that aging process. And what can we do? We eat. We eat well, we eat good, we eat properly, we eat on time, we eat the right amount of food that we could. That's the most important thing. We drink a lot. We hydrate ourselves. 2 to 3 liters in a day. Singapore is a hot place as well, like here in Manila. Our heat index is in the 40s. A week ago, we've had it like in 51. So it's really hot. There's sweating all around and we lose fluids. It's called insensible water loss. We do need to hydrate ourselves or otherwise we'd have problems, not just of heat exhaustion, but the possibility of heat strokes. Three, we need to move. The exercises. You know, we don't need to go to the gyms. Nowadays, pandemic, we really cannot go to gyms. So we can do all these movements in our house, around our house, but we need to do exercises. We need to move. Fourth, anything and everything that's not, you know, not good, might as well stop it. And that's alcohol, that's smoking, that's bad drugs. Fifth, we actually need to rest well. We need to rest well. If our phones need to be recharged, so as our bodies need to be recharged. Last, if we cannot do those things, the sixth one is to help by supplementing ourselves with a lot of things that can help our body boost its immune functions and function properly. So I guess that's my talk for this evening. I hope you got to learn a bit something about osteoarthritis. Thank you so much for listening. Going back to you, Ma'am Lila.
Yes, thank you so much. Yeah, thank you so much, Dr. Rylan Flores. So, I don't know, applause to Dr. Rylan.
Thank you, thank you.
Kasi parang ayaw ko nang kumain kasi parang bulalo ata yung pinakita mo sa amin. Ay, hindi pa naman ako
Bulalo at corned beef.
So parang sabi ko, and as I watch Mini a while ago also, it's like gumaganong kaming dalawa.
I apologize, but that's really how you would look into it. So you'd know what you might go through. Hence, to stop it, you do the right thing, so you won't get to that point.
Exactly, Doc. So, thank you so much talaga, Doc, for sharing us this informative and timely health education, I would say. I myself is aging and feeling those pains, actually.
Sabi ko nga, kalabaw lang ang tumatanda.
Yeah. Yeah, but you know, by this health talk, it gives me an idea again to look after my bones. And imagine, sinabi mo, your first slide a while ago, sabi mo, 206 bones, different kinds of, sabi ko, shucks, ang dami naman pala nun, and different kind of joints and all those things. And it hits me when you are explaining about on the hip side, kasi that's my problem actually, because I'm having a hip problem actually. But and yet, it's a privilege to hear you. And to all our viewers and our guests, we'll have our open forum in a short while. So anyone who needs clarifications and health advice, or for those who have bugging in their mind, queries in their mind, Dr. Rylan will be very pleased to share his expertise. So, Doc, hinga-hinga muna tayo po ng kaunti kasi kanina pa ako hindi makahinga. Nawala ako ng
Walang problema.
Okay, so let's have a few questions here, Doc. So wag kang mawala dyan. Dapat nandiyan ka lang. Okay.
Actually, may mga pumapasok na nga rito sa chat box natin.
Yeah, that's right. A lot of things. Kaya, okay. So there is a questions coming from Bayanihan Center. Okay. What is the difference between the first question we have, Doc, okay?
Yes.
Tuloy-tuloyin na natin, Doc, kasi
Yeah, sure.
parang wala na akong ganang kumain talaga. Okay. What is the difference between osteoarthritis and rheumatoid arthritis? So
well, the difference is actually the cause. The cause of osteoarthritis is still your degenerative process, your wear and tear. In contrast, your rheumatoid arthritis cause is that of immune functions. So yan yung literally nasa dugo na rin. That's the reason why age is a difference. Those who would be experiencing osteoarthritis would be a little older as against those experiencing rheumatoid arthritis. Another contrast is that most of the time in degenerative osteoarthritis, we just have single joints affected. In contrast to rheumatoid arthritis, they come in pairs. So they're both elbows, both shoulders, both knees, both hips. So they usually come in pairs. But whatever happens to the joint, they're both the same. They're both arthritis. So it's just the cause that's the difference.
So both are arthritis. Talagang grabe.
Both are still arthritis, yes.
Lahat na ng tistis sa mga bones.
Yes.
Nakakatakot. Okay, another question coming from Marga, Singapore. Okay, sabi niya dito, which is, ako rin, that's my problem. You know, I don't like milk, but I am concerned about my bones. So I am eating a lot of greens, especially spinach and broccoli. Sabi niya, is this enough? From Marga, Singapore.
Well, you know, although milk is a very, very good source of calcium, as I mentioned, that doesn't have anything to do with arthritis. It has to do with the density of bone with osteoporosis, which is a totally different talk. We'd probably schedule one specifically for that next time. Ano mamini? But the thing is, since that's brought up, though milk is one of those things you can do to increase your calcium component, it can be still seen in a lot of things. Dairy products in general, your yogurt, your cheeses, there are a lot of things. And true, your green vegetables are also very high in calcium. Spinach and broccoli are very good examples. And if you like that, go ahead, be my guest, because they are also good sources of calcium. You also have fish, like your salmon. They're also rich in calcium. So it's not just milk per se, but of course, if you really need and require, there are a lot of supplements that can be given. Not just calcium supplements, but sometimes I do give algae, wherein there's rich in protein already, inclusive of calcium.
Wow. Thank you, Doc, for reminding us kasi sometimes we thought one of the sources only milk. Kasi sa totoo lang, yun din ang gusto kong malaman kasi from the cheese, from our fish din
Yes.
pala, it's good.
As a matter of fact, now that you mention it, on a daily basis, you probably would need around 500 milligrams of calcium. But once you're in the perimenopausal stage group, you're an elderly, you have problems, you have a fracture, etc., 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 you're pregnant or you're an adolescent, it increases to as high as 1 to 1.2 grams in a day. And I usually would tell my patients to just take note of how much they eat or if they drink milk within the day, because if they do that, there's no need for supplementation. But if they really are lacking, they don't have anything to eat but fast food, so by all means, you can actually take in supplementation. But if you are really eating well, you're drinking milk, sometimes you really don't need it anymore.
I see. That's a good one, Doc. And it reminds me also to, drink more I'll try to drink more of milk because alam mo yon, Miss Minnie, menopausal stage na tayo. Okay. So ang dami palang ano. So another question, Doc. Nakakatuwa naman tong talk na to. Okay, another question, Doc, from Adrian Ramos. Any type of food to avoid to prevent joint pains, especially for aged adults? Ako na naman yun.
Gusto kong himayin lang yung tanong na yan, kasi several things food to avoid joint pains and aging. So first and foremost, if we're simply talking about joint pains, that's the reason why we have to determine what causes that joint pain. Remember, 70% is caused by aging and your wear and tear. You still have a lot of 30% that can cause joint pains of a different source. That's the reason why you have to treat it, which means that if your problem is probably bacterial or septic in origin, you have to give antibiotics. If your problem is psoriatic arthritis, you have to treat psoriasis. If your problem is statin-induced arthritis, you have to stop statin intake. But if your problem is aging, wala naman kasi talagang pampigil dyan, di ba? Ngayon, if your problem is degenerative osteoarthritis, it's not gouty arthritis wherein food is the main cause of it. So, if it is degenerative osteoarthritis, walang bawal, isa lang. Bawal ang hindi masarap. Pag hindi mo masarap, huwag mong kakainin.
I love that, Doc. May I ask also, Doc, kasi as you keep on repeating on your in your talk now is yung sabi mo nga, yung aging is wala tayong magagawa doon.
Alam mo, kung may makakaimbento na pipigil sa pag-edad, ano ko doon, makikisosyo ako kasi kikita talaga yun.
Okay na kami ni Miss Minnie dyan talaga, but we just accept the fact talaga, no? But the good news is, sinabi mo kanina, Doc, no? The good news is we can slow down. So,
Yes.
unstoppable aging, but there is also good news kasi we can slow down. Anong
That is
gagawin
true.
natin? We have to move, we have to have the right food, sabi mo nga kanina. So, nabigyan naman ako ng pag-asa.
Oo
Akala ko
naman, oo naman.
and with the proper supplementation nga naman natin.
Yes.
So, Adrian, I hope you get that answer. So, eto pa, Doc, another one is from him again. I was told if I plan to do knee replacement,
Yes.
I was advised to wait till I am 65. Bakit po, Doc?
Okay. One, no. Because the only reason why they say that you have to be not just 65, but a senior citizen or beyond 60 is because it usually happens around that time. But for some individuals, that may happen earlier. And if you really have problems with arthritis, we don't wait. I do have patients 55 years old that require replacement. We do replacement. 45 years old, we do replacement. I have a patient, unfortunately, with rheumatoid arthritis at 19 years old. I had to do both bilateral hip replacement on him. But then again, it doesn't really matter if you're 60, 65, 70, 75. My oldest is actually 90 years old. But the more important thing is not the surgical content, but what is your medical condition? You may be 65, but if your body is 50, kayang-kaya. 85, but your body's 60, kayang-kaya. That 90-year-old of mine, medically, he was like 68 years old. But I do have patients at 50 whose bodies already simulate that of beyond 80 years old. So the more important thing is what is your current medical
Wow,
evaluation and status.
I see.
So if you really need it, go ahead. The only reason for us to decide if you're 60 or not is because we sometimes use the one I showed you is a metal back plated tibial component. For those beyond 60, we put in an all polyethylene, or the whole thing's plastic. It's no longer metal. For some who are younger, we recommend, or for those 60, 65. Why? Because usually the time frame of a good surgery would probably be 20, 25 years, which means if we operate by you at 60, by 85, you're still active. What we can do is replace that plastic component. But if we operate beyond 60, say you're 65, 70, 75, plus 25 years, you're already 100. I don't think I do another surgery for that anymore. That's the reason why we do it on all polyethylene. So the reason for waiting is more of the technical aspect, or what implant to use. But if you need surgery, age doesn't matter. The more important thing is your medical condition.
I see. That's a good one, Adrian. So remember what Dr. Rylan had,
Don't
discussed.
wait if you really need
So,
it.
age, hindi dapat sa edad. So yung medical conditions ng
Yes.
pasyente. So you can always have a second one-on-one with a carpentry, a
I hope I don't need it
carpentry
yet.
education with Dr. Rylan. Okay. So Doc, another question. How effective is collagen?
Very good. I actually give it to my patients. If you notice, I mentioned a while ago, glucosamine way back in 2000, in the early 2000s, when Time Magazine at 2002 mentioned an epidemic of arthritis. So glucosamine was on a rise, still probably around 2006. As a matter of fact, I even give lectures for several glucosamine companies. But because of the gate trials that happened, it doesn't work anymore. In contrast to collagen, collagen really is good. I've been with with actually the Bones and Joints International Council based in Beijing. It's a component of several specialists from Europe, especially Germany, Italy, and the UK. In Asia, like Singapore, Malaysia, Taiwan, and Hong Kong and Macau. Philippines, I was representing Philippines, and we're part of that group. And we've studied collagen, and we've had several studies that have been done, and we've really gotten really good results. But there are stipulations. Your collagen has to be one, type 2, it has to be 2, bovine in origin, and 3, 10 grams. That's the reason why nowadays what we are working on is the nanonization of the component. So you don't need to take 10 grams because 10 grams is really madami masyado.
So that's a good one, Doc. Yeah, that's a good one. So we can, it's recommended also to take collagen,
Yes.
but we need to minimize lang ng kaunti. Ano po? So another question, okay, from Jennifer Cancino Tamundong from Manila. So, okay, may I ask if, is there a connection of osteoporosis with menopausal syndrome?
Well,
Aray, ano ba?
it's not our topic, but yes, there is. It actually is being observed in menopausal women. Why? Because when menopause comes in, your menstruation stops. And when menstruation stops, your hormonal cycle stops. That includes your estrogen and some of progesterone. The problem is estrogen is one of the leading hormones to actually absorb calcium. So calcium is no longer absorbed in a very well state. Hence, the possibility of osteoporosis kicks in. It just doesn't weans in, it kicks in. So we do monitor women with within the perimenopausal age. We do usually do bone densitometries, specifically central ones, to look into your spine and into your hip, because if you are in the severe levels, we start you on medication for osteoporosis. Because as I mentioned in my second or third slide, it's still a disease, a silent disease.
A silent disease. Okay,
Yes,
Jing,
you won't
I
know
hope you get
until
the right.
you fall and you get a fracture because your bones are osteoporotic.
I see. So brittle na siya. Okay. So Jing, you get the right answer. I hope you are satisfied. So another one, Doc, is from JP Marasigan from Calapan City.
Yes.
Doc, sabi niya, when there is pain, when pressing on the area with our fingers, is this considered osteoarthritis or either, ano ba to? When you stand or sit, there is a pain in the portion of our hips. Then what is the best cure we would suggest? Siguro matanda
Well,
na to, Doc. Kagaya ko.
unang-una, alam mo, baka hindi rin. Baka hindi
Okay.
rin.
Okay.
Because for one reason, JP, I would suggest magpatingin ka na. Why? Because your problem in your hands, unang-una saan sa daliri yan, anywhere from these areas. It could probably be one, arthritic in nature, secondary to osteoarthritis, depending on your wear and tear. Two, it could be gouty arthritis, secondary to what you eat. Three, it doesn't have anything to do with arthritis. Pag bandang baba na yan, dito na sa may dulo ng daliri, baka trigger finger lang sa kaka-computer, sa kaka-text, at sa kakakilos at galaw. So you have to have it examined because we don't know what the actual cause is. Two, on that problem in the hip, you clarify where in the hip, because if your problem are in the sides of the hip, then that is actually more muscular in origin rather than arthritic. But if your problem is not literally in the hip, nasa singit, then your hips may actually be a problem of arthritis in origin. So the cure at this point in time, I cannot say because I really don't know what the problem is. So the best thing is to have all of these things seen. But what I can say for the time being is because definitely there is pain, there is tenderness, there is an inflammatory reaction happening. What you can do, you rest. And when I say rest, ipahinga mo na mabuti talaga yan. Two, apply warm compresses over the areas. And in these areas, warmth can give you relaxation. And let's see the next day. If you're better off, then they might be just soft tissue in origin, nothing to do with arthritic problems. But if it still is persistent, then have it consulted and determine what the diagnosis is.
Very well said, Doc Rylan. So it's a free consultation, okay? This time around, this is the good news. This is a good thing naman, Doc Rylan, when we are attending health talk.
Yes.
We are learning and at the same time, we are reminded to look after ourselves back again, di ba? So another question, and I hope this will be the last question na natin kasi 1 hour na tayo ngayon. Okay.
Oo nga, no?
Yeah, 1 hour na tayo. Baka ma-penalty tayo ng bayanihan dito. Okay. From Miss Josie Falcon. Okay, hi po, Doc. Ano po
Hello.
specific vitamins and mabisa to help sa arthritis?
Well,
Salamat po.
one thing we were talking about calcium earlier. Calcium is actually for the quality, density, and thickness of bone. So we do need that. Any food that's rich with calcium, we do need that. But syempre, calcium needs to be absorbed in the body. So we do need vitamin D3, D as in dog. With vitamin D3, usually kasabayan niya ng mga supplements na nabibili sa butika. But for me, I give higher doses of it. I give as high as, instead of just hundreds of international units, I give as high as 2,000, 4,000, 8, even 10,000 units in a day, especially with COVID, because it just doesn't actually help absorb calcium. It actually also boosts immune function as well. Of course, all of these other minerals that you can get in vegetables and fish and everything else, like your magnesium, your phosphorus, your zinc. In meat, you can get zinc. So just eat well. You might not need supplementation anymore. But if you are lacking in nutrition, then you might need all of these vitamins and minerals as well. But sometimes, as I mentioned, I sometimes give algae, something like your cryptomonaдаlis algae, because it's already complete, all in one. So you don't need to think about it anymore.
So, nakakatuwa naman. Well said, Dr. Yeah, nakakatuwa. Okay, so may nandito sa ngayon, Doc. Okay, sabi ni Jennifer Cancino Tamono, thank you, Doc. Thank you, Mr. Bone Carpenter. Sabi niya.
Thank you.
Yeah, very informative talk. Much needed info for everyone. Okay, another one, last one.
Yes, sure.
Natin to. Okay, from Lorna Pascual Binungkal. Ayun na tuloy nag-promote na siya. Siguro lover natin to, Doc, no? I feel I have a knee joint pain. May joint pain siya, knee joint pain before, but when I took cryptomonaдаlis, the pain was gone. What is the role of crypto in my case? Na-mention mo ng
in reality, it actually, if you are well nutritioned, meaning that your body is adept with nutrition properly, and you are well hydrated, you are well rested, that is one form of decreasing the inflammatory reaction in your body. It's a natural course. So with that alone, supplementation as necessary, considering that you might not probably be eating well, then that in itself can decrease the inflammatory process that's happening. That's the reason why it's things like supplementation, like algae, like cryptomonaдаlis, can actually help at this point in time.
see. Ayan. So, thank you so much, Doc Rylan. And before that, sabi ni JP Marasigan, Doc, well said, wow, salamat. And satisfied po ako from...
Well, i-add ko lang, kasi itong si JP ganito, I'm sure may mga tanong pa po at gusto magtanong. Magpa-plug na ako, Ma'am Lila and Ma'am Minnie. Kung sa may mga gusto magtanong po, I do have my page, Doc Rylan lang po, dito sa Facebook. You can actually type in your question and we try to answer the soonest possible time. And for those, like itong si JP, kailangan ng konsulta, I do teleconsults kasi alam mo naman mga panahon ngayon, hindi nga tayo makapag-physical consult, or yung iba kasi malalayo at hindi pa pwedeng tumawid, lalo na nakababol ang Metro Manila. I do teleconsults as well. You can book at Facebook, Doc Rylan. And I also have ipa-plug ko ng tuloy-tuloy, I also have a live every Saturday at 7 in the evening. So Manila time, of course. So if you want to tune in, dyan, pwede tayo din pong magkita. And of course, for those in Manila, there's always internet. DWIZ 882 Kalusugan Kakabilib. I'm one of the hosts there. We have a regular program every Sunday at 11 in the morning. And for those in Manila, there's Abante and Abante Tonight. For those in Singapore, digital Abante and Abante Tonight. There's Doc Rylan's Clinic Hour and Magtanong kay Doc. There are articles there. We talk about anything and everything medical in these shows and columns.
Wow.
Maraming salamat ulit po.
So reachable talaga si Doc Rylan.
Yes,
So,
of course.
So kahit nasaan ka, ma-reach out.
Oo nga.
So Doc, before we close this health talk session natin, please give us your final message, our takeaway message from you tonight.
Well, I just keep on repeating, there's nothing that will stop us from aging. Every single day, every single year, we get older and older and older. But it doesn't necessarily mean that we feel older as we grow older. Dapat yan, yun ang pinapabagal natin at pinapatigil natin. And that's just by treating our own bodies the best way possible. And that's by eating, drinking, hydrating, activities, removing all that are toxins in our body, and resting. And if you cannot do all of that, supplement. And thank you
Wow.
very much again, both Ma'am Lila and Ma'am
Doctor.
Mini and the Bayanihan Singapore. I do wish to go to Singapore again. I miss the food there. Soon.
Thank you, Dr. Rylan Flores
Thank you so
again.
much.
And yeah, we see you. And I see you also in Manila one of
Yes.
these months.
Let me know kasi may shooting lang ako ongoing. So let me know para schedule natin na mabuti ha.
Correct. Okay. So once again, thank you for all our viewers and our guests tonight on behalf of Philippine Bayanihan Society in Singapore for this initiative of having Health Talk tonight. Okay, especially to Miss Minnie Lau, Cecil, and Mindy. So let's get together virtually and stay connected. Be happy and stay healthy. God bless everyone. Yours truly, Miss Lila Bailon Makapinla. Okay, and now let's welcome back our real host for tonight. Rylan, siya naman talaga ang host natin. One of Philippine Bayanihan Society in Singapore, board member and chairman of Bayanihan Walk 2021, our beautiful mother and Lola, ganun, Miss Minnie Lau.
Hi, thank you po. Thank you ng madami. I really truly enjoyed that discussion, very vibrant discussion, very informative discussion, very relevant discussion kasi lahat naman tayo tumatanda. So thank you so much, Dr. Joseph Ryan G. Flores. If you want, you can give us details of those where we can get in touch with you and we can just upload it on our Facebook. Para yung mga tanong pa, they can get in touch with you, if you don't mind. Tapos, and of course, Ms. Lila Makapinlak, thank you so much for joining us. I hope it won't be the first and the last. Ulitin natin to. Ano po? Ulitin natin. So thank you so much. It has been a very wonderful, very, very, very informative discussion. Very relevant. Inuulit ko lang kasi lahat tayo matatamaan din. Lahat tayo tatanda. What I just like to say, aging is not a disease. It's just part of life. Let's just try to age gracefully, diba?
That's true. That is so true.
Yeah, to have that, we have to take care of ourselves, not just mentally, physically, and I think Dr. Ryan said, have a good rest. Kasi lahat, as may rest, the body will be able to repair itself back. So yung po, so before we end, I would like to call Ms. Christy Vicentina, our Honorary Vice President, to deliver the closing remarks. Thank you. Christy, please.
Thank you, Minnie. Good evening to all our friends and kababayans in Singapore. And to our friends and families in the Philippines, mabuhay. On behalf of Philippine Bayanihan Society Singapore, allow me to say thank you to the people who helped us for tonight's webinar. Dr. Joseph Rylan Flores. Thank you, Doc, for sharing your time and expertise to remind us that health is our best wealth, especially during this global health crisis. And thank you for the free consultation. Isang oras din yun na free consultation. So don't forget to like our doctor from FB at Doc Rylan. Meron pa siyang ibang mga link where you can find him. So isa-share na lang po natin sila. And syempre, special thank you, Miss Lila of Noblelife from Team BNG for sharing your resources for PBSS. BNG or Business Network Group consists of Noblelife, of course, PNB, LBC, PLDT, Mega World, Happy Family School of Excellence, and MD Cruz. Sana po marami tayong natutunan para hindi tayo umabot to those cryptic pictures na pinakita ni Doc kanina na parang nakakasuka sila, di ba? And it's really expensive to go through those medical procedures or operations. So eat healthy and live healthy and stay happy or supplement, sabi nga ni Doc. So maraming salamat din to all our friends who always help to promote our webinars. Philippine Embassy Singapore, led by His Excellency Ambassador Joseph Del Maria, Richard and Rex of FLPH, Lynn of CDE, Eloisa of PAUS, Miss Lucy Tagle of Miss Petit Team, Fast Associates, Rated J, Lucky Plaza Ladies, FAS, UAP, Ateneo LSE, OSPAS, Kabayanihan, Jehan and Arvin's team from Middle East. So maraming salamat sa laging nandyan kayo every other Thursday. And syempre maraming salamat ulit, Noblelife and Doc Rylan. Back to you, Minnie.
Ay, naka-mute si ma'am.
Unmute.
There you go.
Thank you very much, Christy, for those closing remarks. And again, I would like to thank Doc Ryland, and Ms. Lilat for making this wonderful hour or so of discussion, very fruitful discussion, not wasted at all, very precious. And I hope we can repeat this again in the near future. So thank you so much again. And wag po kayong alis muna, ha? Anyway, PBSS, just to let you know, is at Bayanihan Center, 43 Pasir Panjang Road. You can email us at bayanihancenter@singnet.com.sg or call 647-43700. Please like our Facebook page, facebook.com/Bayanihan Society SG. Please follow us on Instagram at Bayanihan Society SG. And please support us by donating via www.giving.sg/PBSS. Thank you all very much again for joining us today. I hope you all learned something. I learned a lot because I'm nearing that age. So we hope it has been a very fruitful discussion. Our next Bayanihan webinar is on Thursday, June 10, 2021. The topic will be slightly different. It will be about reimagining marketing in the next normal. So it's about how to be an entrepreneur. Our guest speaker will be Mr. Robert Cristobal. He's the founder of Frame 316 Media. He's currently the president of Alumni Association of Ateneo LSE Singapore, and is also an associate lecturer at NTUC Learning Hub. So we look forward to having you on June 10. This is Minerva Lau, and together with the board and staff of the Philippine Bayanihan Society Singapore, we say thank you for joining us tonight, and see you at the next webinar. Please keep well, keep safe, please wear your mask when outside, and keep safe distance always. Good night and God bless. Thank you.
Thank you. Good night.